welcome to Virtual Face to Face. I'm Alex Lukowski, AVP of Communications. In every crisis, there are real opportunities to reimagine ourselves. And those words were spoken by University of Maryland College Park President Jarrell just a few months ago, sitting side by side, virtually of course, with Dr. Jarrell on this program. Like it or not, it really is a process of reinvention that our universities and so many others around the country are forced to engage in this year. Around this same time last year, the news about research was very different and very positive. The Higher Education Research and Development, or HERD survey, showed our combined University of Maryland research enterprise was looking great. We ranked 18th among all universities, 11th among public universities, and 14th overall in federally financed research, particularly in areas like addiction disorders, genomics, infectious and emerging diseases, cancer, climate change, AI, and of course, quantum science, very big at College Park. But not long after the calendar flipped to January, everything began to change. Among the 26 executive orders signed by the new president just on day one was this one: ending radical and wasteful government DEI programs and preferencing. Now, that executive order has been used as a reason to terminate grants for things like studying healthcare disparities, autism in girls, HIV prevention in Latino and Black men, and a lot more. Another notable executive order, titled Improving Oversight of Our Federal Grant Making, gives political appointees oversight over grant making and makes it easier to terminate for convenience. And there are plenty of other orders and policy statements that change the way university-based research interacts with federal agencies. Now, by early summer, those changes resulted in the freezing or termination of dozens of University of Maryland grants, many of them with multi-year financial implications. As bad as it's been here, though, a small number of universities, other universities, have been under extreme pressure, threatened with the loss of most or all federal funding over allegations of violations of civil rights. Those mostly concerned allegations of anti-Semitism in the wake of pro-Palestinian protests, but they also involve other kinds of campus conduct like diversity initiatives and free speech. Harvard, Cornell, Northwestern, University of California System, Brown, and Columbia saw a combined $6 billion in grants frozen or canceled. And some of them have reached or are negotiating right now deals with the federal government in order to restore funding. For example, $1 billion in grants were at risk at Cornell. They agreed to a settlement that includes a $100 million payout and an agreement to make significant policy changes. And at Columbia, they agreed to pay $221 million and institute what that university calls enhancements to campus safety, changes to disciplinary processes, and renewed efforts to foster an inclusive and respectful learning environment. Now, back here in Maryland, by the end of the summer, most of our research grants that had been frozen or terminated had been restored. And much of that the result of court actions by Maryland's Attorney General, along with a coalition of like-minded attorneys general in states like New York and Massachusetts. But the future is no less uncertain. A late August Supreme Court ruling allowed the administration to move forward with the cancellation of close to $800 million of what it called DEI-related grants, while challenges in lower courts continue. And in September, top administrators here and in College Park watched with cautious optimism as grant awards and requests for awards in the new fiscal year began to come in again. Of course, the government shut down October 1st and has halted all new grant activity. Fortunately, work on grants already approved does continue to be funded during the shutdown. Still, there are so many questions. Will government agencies, as announced, continue to press or slash reimbursement for indirect costs from more than 50% at institutions like ours to just 15%? Will the scale of federally funded research from the largest funding agencies, NIH, DOD, NIH, Department of Energy, National Science Foundation, will they maintain the recent levels, or will funding drop off? Will our scientists and our facilities be able to meet the challenging and changing priorities, particularly in areas like infectious disease and vaccine development? And will our research enterprise be able to count on increased support from philanthropic organizations or even state funding? Joining us today to help answer those questions and any others you in the audience may have are certainly two of the best qualified people to do that. Vice President for Research, Patrick O'Shea, and Robert Ernst, the Dr. Paul and Mrs. Jean Corcoran Endowed Professor and Chair of the Department of Microbial Pathogenesis in the School of Dentistry. He's also a distinguished university professor and has tremendous amount of direct experience with grant-funded research. And as always, as I mentioned, you will have a chance later in the program to ask your questions. You can write them anytime you want in the Q&A area. Unless you tell me otherwise, I'm going to assume you do want to ask your question yourself, so please be aware of that and listen for your name. Now please welcome our host, UMB President, Dr. Bruce Jarrell.
Thank you, Alex. It's a pleasure to be here. I'd like to welcome all of you on the screen. Hopefully we can get some information to you, but I think the biggest piece of information perhaps to deliver to you has been that we have been very, very busy. We've been busy understanding what executive orders have taken place, busy looking at what are the implications of them, looking at what we should be doing. This applies not just to research, but broadly for the many activities that the new administration has brought forward. And as we have this discussion, I want to remind everybody that it is an opportunity to examine how we as a university function in terms of interacting with the U.S. government, an entity that's very important to us and who has been a partner for 80 years. And so part of what I hope will happen with this is you'll hear sort of what different people's thinking is in terms of how that relationship evolves, and you'll have ideas that'll help us. But I think the biggest message to let you know is we've been very focused on this intensely, and I thought COVID was intense, okay, and we're finding out that COVID was warming up for this one. So maybe with that sort of underpinning, I want to reemphasize one thing that Alex said. We really want to have your questions and address your questions. Pat and Bob and I can have just a fine conversation, but it would be much better to be addressing questions that you have. So we're going to try to keep answers short, keep your questions not too complicated, and hopefully we'll be able to get some information shared among all of us. So with that, I'll start out, and this could be really, I'll aim this one at Bob first. So Bob, you can remember there was a time when you were a young investigator. I know, not anymore. Okay, but you've got lots of young investigators around you in your lab, et cetera. What do you tell your young investigators? I include graduate students and certainly junior faculty, postdoc. What do you tell them about this moment in time and how to think about their career?
You're muted, Bob. Well, thanks for inviting us to and have a chat about this today. I think what you have to tell each group is something completely different, because I think what you have to do is you have to first start out by telling them, and it would be very difficult for them not to know what's going on. So what they know is that the federal government has changed the way they're funding. Funding is not as guaranteed as it used to be. But at the same time, I think if you're telling a senior postdoc, you have to have a conversation with them saying, you have to try to submit grants. You have to try to see what the outcome is. And at the same time, it's a very difficult time for them because it's basically a little scary because they don't know what the landscape will be going forward to go find a new position. A grad student, on the other hand, might be in a more advantageous position because especially if they're in the first 2 or 3 years, what's going to happen next year, what's going to happen by the third or the fourth year of their career could be very different. And it could change depending on what's happening with NIH, what's happening with the government. So unfortunately, the best thing you can be with anybody you're mentoring is just be honest and try to keep talking with them as much as they want and as much as you can.
So we're down in our total grant funding by maybe 10 or 15%, depends on how you measure it. And yet, when you look at grant submissions, we're up by 14%. I think Dr. O'Donnell told me last week. So people are working hard to get grants out the door and to the NIH, although with the government shutdown, who knows whether they're getting through or not. So Pat, tell me sort of how you view this landscape. You've got people who work for you. You've got people in labs. What do you tell them about the future of their job and the security of their position, et cetera?
Well, I tell them, like you have said earlier, Dr. Jarrell, that we are committed to working with them, for them, with the state government, with the federal government, to sort of preserve their ability to do research, education, and service, to help them to pivot into new funding areas with the prospect of growth. Okay, so yes, we're under stress, but to paraphrase the quote from President Pines earlier, there are opportunities embedded in all of this. And you asked Dr. Ernst earlier, what would you tell young people? I would say one of the most important things for a young person, or for all of us, is to communicate what we're doing clearly and simply, right? Because in talking with people, not just in the US, but around the world, there's a lack of trust in academia and in academic research among the general public, okay? And it behooves us then to communicate what we do in very simple terms. So I'm certainly committed to working not just with our young people, with more senior people like us, to really get out there and communicate at all levels, state, federal government, and with ordinary people here in Baltimore and throughout the state, about what we're doing to help heal people, house people, feed people, and all of these good things. So even though times are tough, I'm optimistic that we'll make it through this. You said, Dr. Jarrell, about COVID, right? That was an existential crisis. It looked like we were going to lose, huge amounts of revenue. We'd be shut down for ages, but we made it through it. So it shows that we are strong, we are adaptable, and we are resilient.
Yeah. So Pat, you see both campuses and you see the research that goes on in them. And you just talked about opportunity. So what are the new opportunities?
So, the federal government recently, OMB, issued a set of new opportunities. And if you look through that, there are a broad array of things, everything from chronic disease to biomanufacturing, all the way down to quantum computing, to artificial intelligence, health computing. And these are areas where collectively, between the two campuses, we have tremendous strengths. I mean, we have been working for the past 14 years or so to develop the Empower relationship, which is now very strong and very needed in this environment. So, I see, the basic physical sciences, engineering at College Park, like quantum computing, which is a big priority now for the federal government, enabling artificial intelligence, which is a big priority for the government. That then connects into health computing, and we have our Institute for Health Computing. That then begins to enable personalized diagnosis, and then the design and manufacture of personalized pharmaceuticals and treatments. So I can see an arc, it's a long arc, between fundamental science and engineering at College Park directly up to patient care here in Baltimore. So I think we are very well positioned with our unified research effort to make it through, to survive, to prosper, and to grow.
Yeah, of course, the nice part about a long arc is you make a lot of progress and it's continuous. The tough part about a long arc is if you have interruptions in funding, et cetera, you lose a lot of ground. And so building a team and keeping it in place is really important. Bob, what opportunities do you see? Infectious disease, vaccines, a lot of different areas. What do you see?
Well, I'm going to go back real quickly and address something else. I mean, we've run through these really bad times in 2008 when NIH wasn't really giving out any grants at all. We weathered that time. It's not fun, and it's really difficult, as Pat was saying. The most important part of our science is the ability to maintain the intellectual capital, the people in your lab. They are really the people that are the most important to science, because people who you work with on a day-to-day basis, that's what we're all trying to protect, whether it's us, you, and everybody else from the state and the school down. opportunities, I think what they put out for the opportunities is just a couple of very high level opportunities. I think all the other ancillary opportunities are still available. It doesn't mean you have to go follow something that you weren't doing before. I mean, pivot and do a 10-degree turn or 15-degree turn, but doing a 90 or 180-degree turn into something completely new is going to be very difficult in the time when Bruce was saying that we are now 14, 15, 16% more grants are coming out of just our institution. So everybody is putting in more grants to see what's happening. And I think what going forward will be good basic science, solid hypotheses, solid questions. And if you have them, the review will still be the same. If you get past review, we are going to run into problems, as Bruce was also saying. I think maybe Alex, there is between the reviewer and us getting funding, there are other political individuals who can now change the trajectory of that grant, whether they don't like words, whether they don't like the science, or it doesn't fit into the box that they want to fund right now. I know it's discouraging when you see that, but you just have to have perseverance because things will change over time, one would hope.
Can you pick up your phone and call your project officer or your program officer right now?
No, not now.
Could you before the shutdown?
Yes.
So somebody was answering the phone, you could have a real discussion with that person about whatever you had on your mind.
You may not be able to get them directly on the phone, but in the next day or two, you could easily get on with most program officers. And that's at least in allergy and infectious disease, we could do that quite regularly. We routinely have conversations with other contract officers weekly, if not monthly.
Right.
So there are a lot of wonderful people still employed within the context of NIH review and funding and budgeting and all these other things. They too are under amazing stress because they also want us to succeed. So again, there is a resource there when we're allowed to talk to them again or when they're allowed to talk to us. But as soon as the government opens up again, there's a very good chance that queue is going to be massive. So don't be discouraged.
Right. Now, I know Alex is mounting questions, but before, Alex, we get to you, one other question for the two of you. We operate in a particular way. We operate where direct funding goes to a lab and indirect funding goes to support infrastructure in one sort or another. And sometimes it gets reinvested in different ways. And there's been a major discussion about what should happen to indirect funding. And for those of you in the audience, when you get a grant, it pays for your direct expenses that have to do with the lab, et cetera. And then it pays the university some fraction of that, which can be 25, 30, 35% in terms of the total cost to help keep the lights on. So there's a couple of proposals floating out there on this. Pat, what's the rumor mill saying?
Well, there are lots of rumors and lots of spiky noise, but I like to put what I call a low-pass filter on the spiky noise and look and see what the signal is. It's clear that I think people understand, broadly speaking, that we do need those resources to pay for the fume hoods and pay for the buildings and the IACUC, the IRB, the safety, everything that is necessary to run the research program. The discussion now is really how should that be paid or how should it be costed? And so I think previously the current model, I should say, was reimbursement for expenses. Right. Let's say you have we get reimbursed for you have a fire in your home, you rebuild it, you get reimbursed, and you could sort of spend it any way you want. The new models are more directly charging and directly assigning those monies to the cost centers, to the IRB, to safety, to the electricity, and all of that. And I think that makes sense. Of course, it'll involve a lot more work in terms of cost accounting. But there's been a group called the Joint Associations Group, which is several associations associated with national research, chaired by Kelvin Drogemeyer. And they've come up with a model which is called the FAIR model, okay, which basically looks at coming up with accountable ways of charging and paying out the facilities and administrative, the overhead costs, and giving them to the university. So that has gotten a lot of traction, a lot of support in Congress. And so what we're waiting now is for Congress, the House, the Senate, and also the Office of Management and Budget to come out with an outline policy. And so we've been working very hard behind the scenes, modeling all of these systems. And it looks like we can manage it, but we will have to do business differently in terms of being more accountable for how we spend the actual overhead money.
Right. Bob, anything to add to that?
I think things will change. I think the new paradigm is coming. It will not be called indirects anymore. But at the same time, we as basic researchers, people who have labs, clinicians who have clinical space, you're going to function basically the same. There will be some terms that the goal will be is that the university will help bin things, and then they will help you write your grants and figure out how you're going to charge these now what were indirect costs to be more university direct costs. So the school, the university is already working on proposals to help speed this through if this FAIR model comes through. The problem that arises now is that we don't know if the FAIR model is going to come through. So we might be doing a lot of practice for nothing, or we may be really far ahead of the curve. And then when this actually hits, we'll be ready to hit the ground running.
Right. And the problem's going to be like a 2-year grace period here. So we want to do all the backroom work such that the individual investigator doesn't have to really think about this. In the current model, the individual investigator doesn't have to think about the overhead facilities and administrative charges. And we want to get to that point. Okay, so again, that basically when one is submitting a grant, you don't have to think about this in real time.
Right. So it pays to prepare, but it doesn't pay to prepare too far into the weeds because you don't know what they're going to be. So unless you got a crystal ball. Alex, what you got?
Well, before we get into sort of the nitty-gritty questions that people have, Patrick Bravois at the School of Dentistry has a broader-based question. Patrick, do you want to go ahead and ask your question?
You're muted.
Yeah. So, I'm interested in what you have to say, but this is basically managing and navigating the grant situation at UMB in the current condition. And that's fine, but I think there's an all-encompassing problem here, which is a broader loss of trust in expertise, and that's worldwide.
Yes.
Which is fueled in part by what I would call public misconception about fact-based science. So my question is UMB doing anything to better communicate the science it produces to the general public? And I was thinking about, like, for example, the CVD has amazing expertise in vaccines. And there is a lot of misconception about vaccines these days, which, everywhere. And so the CVD could be involved in, communicating what it does to the public, I think better than it does right now.
Right. So actually, I'm noticing that Laura Kozak is on this call as a listener, and we've had a major campaign in this area. And Alex, you can.
I can let her talk, but she'll
talk. Don't talk too long. I know you like to talk. What would you say to that?
Laura?
I'm here. Sorry. Can you repeat the question?
Discoveries can't wait. All of the campaigns.
Breakthroughs can't wait.
Breakthroughs can't wait. Yeah. So there's a major campaign going on right now that addresses all different types of research across the university. It's called Breakthroughs Can't Wait. And I would encourage everyone to go to the website and take a look at all the videos that Alex and his team actually have expertly produced, along with working with the communication directors in each of the schools. So as of now, that campaign is going to continue for the near future, and we're looking at different ways to bring all different types of research and researchers into that campaign to be able to continue to show why research matters and how important these breakthroughs are. So in addition to those videos, we also have social media campaign that's seen excellent results.
Yeah, that's what Patrick wants to know beside the websites. What other things are you doing to actually touch people?
So that is one thing that we've done. And the social media part of that, believe it or not, we've had far more than 300,000 video views. In other words, people actually watched the videos on their social media. They're short, of our own researchers talking about what they're doing and why it's important, how it can impact people. And that's one way of doing it. There's certainly a lot more that we can do. And you mentioned people's understanding of vaccines, how they work, what they do, what they don't do, how important they are, what's going on with the mRNA platform possibilities I seem to read about a new one every day. So there's a lot more that we can do, and we probably should.
I think it's important for every one of us, every single one of us here, to have our own little micro stories that we can tell our family and friends. Mm-hmm. Right? I mean, I think it's really important that everybody go out there and infect all of the community with whom we interact with little stories about the successes and the outcomes of the University of Maryland's research and education and service, because these are not independent objects. These are closely coupled. And there are a tremendous amount of stories out there. And everybody should play their role, not just the lead communicators.
And then there's a lot of faculty on our campus who go to Capitol Hill. They go talk to Congress. They go talk to Senate. They're always looking for someone to go with them. So the next time they come around asking for your help, they really need your help. So it's okay to say yes and go out and tell people about what you do, and then tell what the campus does, and tell what Maryland does.
Exactly.
Alex, thank you, Laura. Thank you, Patrick.
Now, a little more nitty-gritty. An anonymous attendee writes, you've mentioned keeping a team in place, how important that is. What is the university doing to protect the most vulnerable, the lowest paid, the members of the team who maybe they're junior members particularly, or they're on staff supporting research from being laid off or losing their jobs?
Well, I can talk about that a little bit if Pat and Bob don't. First of all, the majority of this has been in the School of Medicine, because that's where the biggest hits have been occurring. There was a seed grant program put into place several months ago, which is a total of $5 million. And half from UMB, half from the School of Medicine. And it's aimed at new proposals, particularly for younger investigators who have good ideas. We have set aside money relative to graduate student positions. I think much more importantly is what about the future? And we are in major discussions with additional ways to get additional money. I can't give you details right now because they're not worked out, but the idea is really to get tens of $millions reinvested into UMB, particularly new ideas, terms that we're using pivot funding, which, as I think, as Bob said, not 30 or 90 degrees, but 15 or 10 degrees from their current area, looking at new sponsors. So there's been a lot of effort in that. And I would say that Dr. Ward and I have met with over 15 groups of 10 to 15 faculty each to hear their concerns, to hear their advice, et cetera. And that exact question comes up pretty much in every group. So I'm going to say there's a lot of attention, but I'm also going to say things move fast and it's hard to keep up with them. And so we're trying to move just as fast as the changing target. Bob or Pat, you want to add anything to that?
Well, yeah, I know that you and Provost Ward are doing a tremendous amount of work behind the scenes. And I can certify, based on my experience with all the universities around the country in recent weeks, you're doing a top-level job, absolutely a top-level job. Okay, and a lot of that goes unseen because, as you said, you can't talk about everything. But I think our colleagues can be sure that you care about every single one of them.
I pay Pat a lot for that comment.
I was going to say that was pretty good.
Bob, anything to add?
I think.
And Bob, you don't have to compliment him, by the way. I just want to be clear about that. They don't have to follow up.
You mean Pat or Bruce? Which one?
Yeah, either one. Yeah.
I think we have to start thinking outside the box. 5 years ago, going to foundational grants, going to companies, going to all these other things were something that really wasn't what we were going out and doing. Now those are perfectly viable options. But I will say, I sit as a reviewer for the Cystic Fibrosis Foundation, and we've doubled in the last 2 cycles, doubled the amount of applications. And it's going to become difficult for a little while. Mm-hmm. I think Maryland Catalyst Fund, if you want to do a startup, does your ideas come to a point where you think you can go out and get startup money, external funds? Maybe this is the time to start asking questions. We have Empower, we have a lot of good programs where you can ask basic questions to see about moving outward. And this might be the time just to find out if that's the right thing for you.
Alex?
What about foundation money? I mean, one of my most exciting stories to me lately has been Kirsten Lake's research into use of monoclonal antibody treatment to prevent malaria, which is, a huge killer in sub-Saharan Africa. That's a Gates Foundation.
Yeah.
But is there that much room left in those foundations to fund more research like that?
Kirsten's on the call. Kirsten, you want to answer?
Oh, I didn't see her. Hold on. Let me get down to
Bruce is trolling the list.
He is really.
I like participation.
Yeah. Do I see her? I don't. Oh, I do see her. Okay. Go ahead, Kirsten. Kirsten, do you want to
mute?
Talk about that? She didn't know I was going to plug her research.
Of course not.
It's exciting.
Well, while you're waiting for her to come on, foundations can do very targeted things. Gates, their focus has changed significantly over time. And if you're within their targeted population, targeted areas of interest, then definitely cystic fibrosis. There's a whole bunch of foundations that you can go to. Previously, one of the difficulties with foundations was the smaller indirect cost recovery. But at this point, because we have no idea what any indirect or direct or whatever we're going to call them in the future are, these are a significant amount of money. And you also get to get feedback from people within your area of expertise. So even if the grant doesn't get funded, the next time you submit to NIH, it may be even more well received.
And what you got to remember is that research universities started with foundation funding right here in Baltimore. I mean, for the first 70 years, almost all research funding was philanthropic. Johns Hopkins, the Mellons, the Stanfords, the Rockefellers, the Vanderbilts, University of Chicago, all of the major research universities were founded on philanthropic money. And that's the way it existed for 70 years until the federal government came in. And once the federal government came in, a lot of foundations pivoted away from funding science and funded other things that the federal government wasn't funding. So I think you're going to see a shift. Again, if the federal government moves away from funding certain areas, to some extent, philanthropic organizations will. But there's a limited amount of resources. But where is the real research funding? I mean, something that's a vastly greater source of research funding is companies. I mean, companies spend about 4 times as much on research as the federal government does. But companies only spend 1% of their research budget at universities, all universities across the country. So, we may be moving into a new area. We started with philanthropy, then federal government, and now adding to that a greater degree of corporation funding. But that's not going to be easy. But there's certainly a lot more resources out there. I mean, there's $250 billion a year in healthcare research out there that we're really not tapping into, which again vastly exceeds the amount that could be available from the federal government. But figuring out how to frack that money, how to get it out and into our institutions is a challenge that I'm interested in undertaking.
Kirsten, so what are you seeing relative to foundation, particularly Gates Foundation?
This is Kirsten. Can you guys hear me?
Yep.
Yeah,
Yes.
Yep.
Yeah. So, so the Gates made an announcement that they want to basically distribute the funds that they have, 200, I forget the exact quantity, but over the next 20 years. So they're on a timeline, and they do not want to fund early phase research, which is really our specialty. They want to fund projects that are, on the cusp of being ready to go and go right to the field. And it's great that they want to field operations, because that's been a major detriment with the current climate, is that international studies are not being funded and vaccines are not being funded, or vaccine studies. And so we're kind of, it's a double whammy for the Center for Vaccine Development. But we're trying to make lemonade out of lemons, and we are turning a lot to industry funding and trying to drum up as much as we can from the nonprofit sector, like the Wellcome Trust and CEPI and other funding mechanisms. But those are incredibly competitive. So again, like everyone, we just have to keep on writing grants. I think I've written more grants this year than probably the last 5 years altogether.
Great. Thank you for that. Alex?
Well, I just a quick question so do private industry, though, they're sort of have a reputation for not funding so much basic research, right?
Correct.
So that's a challenge.
And so we got to figure out a way where it's in their interest to do that. And I think that's going to involve the federal government, tax incentives, and state government. So yeah, it's got to be in their interest to do it.
Okay.
Kirsten, what are you seeing there?
Well, we're seeing a lot of small companies come to us, and maybe it's because in the past we might have said, we're pretty busy, we can't really maybe pursue that. And now we're pursuing it because we can't really turn away anything. So I know for myself, I'm taking on some projects that I might not have taken on in the past, but also there's been some new opportunities of groups coming to us that want to get things rolling. And so we're just, we're being scrappy and trying to just be open to almost anything.
Thank you for letting us put you on the spot.
Sure, no problem.
All right.
Alex?
All right, Barbara Resnick has a question that I think will be right up your alley. Pat, Barbara, are you still there?
Barb, you're muted.
Yep. Go ahead.
Oh, I was just asking about thoughts regarding interdisciplinary research in the future, in the new world. And I would also put a plug in for foundation work, small, big, or otherwise, just to keep things going, to do pilot work, so that then once things open more, a larger grant can be submitted.
Absolutely, Barb. I mean, interdisciplinary is the way of the future. It's not just the professor and their students working independently. It's working collectively and across boundaries. If you look out in front of Davidge Hall, you see these pillars that support the portico, but nothing happens in the pillars. It's in between those pillars where the people interact across boundaries. Absolutely. So I think much more collaborative, much more collective behavior within our campuses and between our campuses. And I think you're starting to see a lot of that. So we'll be working to create opportunities for people to get together, and also then working with them to submit grants and so forth to get the funding for these interdisciplinary opportunities.
It was always hard to get collaboration between the two campuses. Mm-hmm. How do you have a joint conference where both sides show up and talk about things that end up with grants? So we need to work harder on that.
We do. Well, sometimes, herding faculty is like herding cats, but I found that you can herd cats quite effectively by moving their food. So we need to sprinkle some food in the direction we want them to go. Okay. So it's in their self-interest.
Bob?
I will say it's not that hard to interact with people down at College Park. It does take effort, but it's not hard. There are people at, whether you want to go from Towson to UMBC to UMCP to UMB, all you have to do is start a conversation. But again, if you don't start the conversation, or you don't have someone else reaches out to you, you're never going to make these connections. And it's not that hard to do it, because once you get, say you may have a bioengineering project, you go to the bioengineering group, next thing you know, you've picked up 6 or 7 other people at bioengineering who have different ideas to make your initial idea or question different. And that becomes an iterative process where you go back and forth, and you have the Empower grants, and you have all these other small grants that you could potentially start doing work with, or you can now start writing grants together, because now you have breadth, you have innovation, you have all of these things that NIH is looking for. And if you're looking for areas of research that will cross a number of the current, ideas that they want to fund, having 2 or 3 of these ideas into a single proposal can happen, but it's really up to how much effort you want to put into it.
Right. And then helping to create the opportunity, not just sitting around and waiting for the email that says there's an opportunity, but heading, take the MARC train or the Amtrak down to DC and start working agencies. And the important thing to remember, on your way to DC, you can stop off in College Park as the train stops there. So you can, get on the new Purple Line, which is getting close to being finished, and just pop onto the campus.
Yeah. Don't even say that.
They don't like the Purple
4
Line.
years behind. I live right next to the Purple Line. No. No.
That's not
But for all of you on the call, you know that there's a new building across the street at 4MLK.
Yes,
right.
And that building, in addition to many other activities, the 4th floor is committed to a joint bioengineering medicine program. We actually have College Park faculty with appointments whose geographical base is there. We have graduate students there from both places. And so that's an opportunity to collaborate. And yes, it has the word medicine, but it is not limited. It is bioengineering as it applies to health sciences. And so certainly you should take advantage of that. So stick your head in over there and find out what's going on.
And by the way, if you want to see that kind of cooperation in action, the two guys who run that are Giuliano Scarcelli from College Park and Osama Saidi from Baltimore, and they are thick as thieves. They love working together. You see it. They stimulate each other, intellectually. I mean, it's a great partnership, and so it's a great thing to see. Speaking of getting people prepared, though, for other kinds of grants, Andy Coop at Pharmacy writes, different funding agencies require different, things to be written differently. You can't just turn around an NIH grant and turn it over to a foundation or industry. Any idea about training UMB folks to write for different agencies? Like, we talk about training teachers to be more effective at teaching. Well, grant writing is, as you know, is difficult and can be arcane.
It's incredible.
It's training more with grant writing, but also the backroom stuff in terms of the contracts, because our people are very well set up for dealing with the federal government. Dealing with companies and to some extent foundations requires more work. And so we want to have, in the new model, dedicated people who are experts in those areas, so that, again, our researchers don't have to worry about a lot of that stuff, and that we're going to help them everything from writing the proposal to making sure the terms and conditions are easily handled.
And then the other thing, there are NIH contracts, which are very, very different than grants.
Right.
And if you want to do an NIH contract, the monies are much larger. Mm-hmm. But the process is incredibly difficult. But what the best way to do it is to go find someone on campus who has one and ask them for their grant. I have one. I will be happy to share. There's business and technical components, because Jacques Ravel gave me his. And I don't know if Jacques got it from somebody else, but just knowing the format so that you can spend the rest of your time writing this 150-page document can go into more of the science. So I think what the best way to do is, if you're interested in something like DOD, completely different ball of wax. The contracts, all these things, I think maybe that's something we could potentially get together of a list of people who have or had active grants, who would be willing to be someone to talk to, someone to mentor, someone to show you how to do certain things. Because a lot of times you will find out that you're stumbling on the easy things, and these other funding agencies are looking for something completely different. But it is really a good idea that where we should become a resource. People who have certain types of funding mechanisms should be a resource for other people who are interested.
Yeah, I mean, if you look around, you will find people on both our campuses who have had success with these other types of agencies and companies and so forth, and using them as a resource to help their colleagues who are trying to pivot into these new funding areas will be very important.
Alex, keep going.
All right. I think she's AVP of International Operations. If I got that wrong, I'm sorry. Anna Schoengert has a question about the business side of research. Anna?
Hi, Alex. Can you hear me?
Yep.
Great. Hi, everybody. Yeah, this is kind of a flip side question to what you were just talking about business development or grant writing capacity. In the team that I'm part of, International Operations, we spend a fair amount of time advising faculty on aspects of project design, how to develop scopes of work for consultants, how to schedule deliverables and milestones and payments against those milestones, how to manage resources, whether it's personnel or money or time. And so I guess it's an observation, not a question, but as indirect costs are becoming harder and harder to justify, or as we're being pressured on IDC recovery rates, and given the trends and the messaging around distrust of academia and eliminating waste, et cetera, my observation is that in order to sustain our research strengths, I think it'll be, more important than ever to also compete on the basis of cost benefit and value for money. And so I wonder if there's an opportunity for UMB to help our faculty, our research administrators, our project managers look for ways to strengthen those capacities as well when we're designing research projects and we're implementing research projects, to think about value for money, look for opportunities for efficiency across all of our systems, across all of our units on campus, and help us to be able to market ourselves as a university as good value for money, in addition to our breakthroughs that save lives. Thank you.
Comments, Bob? Pat?
Yeah, no, that's great. The price cost value thing is going to be very important, that whoever's paying needs to see that they're getting value for money. Okay, whether it's the federal government, foundations, or industry.
I think it's going to be difficult, Anna, because the government, like grants are small. They're kind of treated as gifts. If you do with what you propose within a framework, you will, in theory, back in the olden days, you would be able to maintain that grant. And I think one of the problems that we have now is determining what cost benefit is in an ever-changing amoebic world. And I think that's what's really hard, because we try to figure out what we like to do, but at the same time, you've seen many researchers over your career who have became very ingrained into a very small area of research, and they didn't want to adapt. And unfortunately, science and funding has passed them, And I think that we're at a position now where you have to adapt. You have to talk. We are all literally one street across from each other. If you can go across and you can talk to anybody in literally any school in 5 minutes, it means that there is somebody's door that you can potentially show up with to try to find something where, does my idea have value in pharmacy or clinical or medicine or all these other things? And I think, unfortunately, you just have to go start knocking on doors, especially in this era where you're not getting 1 year grants. You're getting all 5 years at the same time. And you have to now become not only a researcher who just received a grant, but now you have to be a true business person who now has to figure out how to spread that 5 years out. Because at this point, there's no rules that say you can't spend it all in the first year.
Right.
So, guidance from NIH and the government comes long after an edict is made.
That's true. But we're all going to have to live much more in Pasteur's quadrant. You've all heard of Louis Pasteur, who was both a great scientist and also invented pasteurization. So, he did the basic bacteriology, virology, and then, applied it in the real world. And I think we're going to have to see a lot more of that.
Okay.
You were talking, Bob, about reaching out to contacts within the university. Several people have asked some variation of this, which is, how do we don't have all those contacts. If we just know our research, how do we find the people to even appeal to outside of the university? How do we find the grant makers, the businesses? Can you help us guide us so that we can go ahead and find those grants?
It used to be if you could go to grants.gov,
right,
and you could find things that way.
The government grants, though.
Government grant, but I think for businesses, a lot of times they're word of mouth. You hear about them. The DoD, the NSF, those are on the same schedules. BARDA, DITRA. Those are other different granting agencies that are very specific in what they want. The DoD is, you just have to spend a lot more time for those types of grants on the internet. There are you can do one-page white proposals for a number of companies if you go looking and you can put them in. I will tell you that my success rate for doing that has been bad. But at the same time, we have had university programs where we worked with a lot of the companies up on the 270 corridor, where the university went out and said, hey, we'd like to show you a whole bunch of our cool technology. And that's the Office of Technology Transfer, and Jim Hughes's group do a lot of that, where they can help us go out and introduce us to some of the companies in the area to see if anything in their portfolio fits. Unfortunately, there is no easy one-stop shop. On campus, go to other departments' seminars. See what's being presented. You will start to meet other people at these seminars. There's a lot of them every day, to the point where you could get nothing done and just go to seminars all day. But I think that's the first place to expand your network, is to go and do something different.
I see we got Chris O'Donnell on the call. Yeah, Chris, you're not going to escape. You've got a whole lot of things like that in the School of Medicine. Can you tell us about one or two?
Go ahead, Chris. You can unmute.
Sorry, can you repeat the question? I was distracted for a moment with a text.
You weren't paying attention with us?
No,
I have been up to this minute. I just got a text.
No. Examples in the School of Medicine that can point you to industry, that can point you to other investigators, the CAR T program, those types of things?
Yes, CAR T is very helpful on that. Our Office of Research Affairs is also really good at scouring what's out there and sending it to the appropriate people. The one word of warning I would give in this is submitting futile grants. It is something that we have to avoid. So, for example, if there is a national competition from some industry sponsor that's going to give 2 awards across the entire country, I don't think we want to have 10 of our young PIs working on that with a ridiculous odds of getting it. So there has to be an element of sophistication about when you go after grants. And it's always been easiest for federals because, we know pay lines, we know, percentile scores, that type of thing. It keeps us orientated and focused. But I think, with foundations and industry sort of public competitions, we have to be careful. I think where we can make progress is, if you have specific connections with industry, even with the DoD, there's a lot of backroom stuff you can do with personal connections that may open up opportunities that sort of aren't available necessarily publicly.
Right.
Yeah.
And many universities now are using emerging AI tools to connect researchers with non-standard opportunities outside of the federal government. That is, mining the database of publications and so forth that our colleagues have, and then looking who out there beyond the obvious might have that. But, as Chris said, we don't want to be submitting futile proposals. In fact, we might want to submit fewer but better. We know that our colleagues have increased significantly the number of proposals, and I would rather see that we focus on quality, not quantity, because typically at least 2/3 of our proposals fail when we submit them. So that's a lot of work that goes into these proposals. So working with our colleagues to up the probability of success, because even if the pay lines change at an age, the best people will still get funded. The best proposals will still get funded, I should say. And we need to ensure that we are the best and second to none.
So, Alex, we're almost out of time. Maybe one more short question.
Well, I don't know if it's a short question, but you mentioned the best will always get the grants, and this sort of fits with that. We have the best today, but 20 years from now, the best are going to be people who are young. They're coming out of college. They're deciding, do I want to go into science or not? Mm-hmm. And maybe some of those that are really talented are going to say, wow, this is not a great career path. I know you're all concerned about that, but is it something that you're actively doing anything, or is there anything you can do about it?
The answer is yes-ish. I think what we have to do, the easiest way to do is to take the students that are here, really invest time and energy and effort into them. They will go out and they will be our best advertisement. If they've had an experience here that's positive and successful, it's one of the best ways to recruit people to come to your lab is by having a lab that is inviting, or a lab that people have gone out and done good things, and not every student is going to, or this, that, or the other thing, or it's one of these things where we are lucky that we only reduced our incoming graduate class by a very small percentage. I think Maryland will get credit for that in the future, showing consistency, showing that this is a place that people want to come to as compared to other universities that have cut their classes in their entirety.
Pat, last word, 1 minute.
By working together in partnership, we will prosper.
That's an old Irish proverb. Is that what that
Exactly, loosely translated into the English.
Alex, anything else?
Nothing that can fit in the next minute and a half, but I'm sure it's great. People want an idea of what are we doing. I think you've given that to them and what they can expect, and we'll just have to wait when the government reopens to see how that grant pipeline continues. Hopefully the spigots will open up.
Yeah, there's a lot of shoulders to the wheels here of keeping things moving and looking for ideas, and we will obviously continue that. So I want to thank Pat and Bob for a great time, and for those whom I surprised by asking their opinion, but it was really, really wonderful to hear those opinions. So I apologize for putting you on the spot, but I thank you for such great comments. So with that, we'll end. Thank you all very much, and see you next time.
Take care.
Good luck.
Bye.